Right, we're just starting to hear what these replacement plans would be, and one of the key things that Republican lawmakers are now grappling with is just how many people are going to lose their insurance coverage. We sort of knew that repealing Obamacare and replacing it with any one of a number of Republican alternatives really would increase the uninsured rate to some extent, and what we're just trying to understand now is just how much.
Now, we have a congressman who's become the Secretary of HHS, Health and Human Services, Tom Price, who's had a proposal to replace healthcare, the ACA, for some time. He makes a big distinction between access on the other hand and coverage. And basically, access says you can get it if you can pay for it. Is that where they're headed?
That is where they're headed. So one thing that Republicans are going to say is our plan increases access to health insurance. And here's why. We're going to give everybody who doesn't get insurance through their job, we're going to give them some sort of tax credit. We don't know exactly how much, but some tax credit to, let's say, 20 million or so people to help them buy insurance. That's more than get tax credits under the ACA. Now, the big difference is that under the ACA, those tax credits give more help to poor people, and that would not be the case under the Republican plan.
And also there are restrictions about how much more you can charge older people in insurance plans. Is that likely to go away?
I think what they're probably going to do, and they're still working on this, is widen how much more you can charge old people. But this is going to be unpopular, so this is something to watch. AARP, of course, hates it. The idea being that they don't want old folks who actually need health insurance more to be charged so much more for it.
So as I referred to in the introduction, we're having these town halls we're seeing around the country. People seem to be really up in arms. What's the popularity at this point of Obamacare?
That's right. We've seen a few surveys just this week come out. Obamacare's popularity is starting to go up in one survey, at least above 50%, which we really haven't seen for the last few years. So, it's sort of the old, saying that, once something's going away, you start to appreciate it a little bit more.
What are the consequences for the budget, the fiscal consequences for the country of the sort of plan you're looking at from the Republicans?
What the Republicans do want to do is come in at a lower cost than the ACA. But the key is the ACA has a lot of taxes, and Republicans want to repeal those. So it's going to be tough for them to do that, fund subsidies, and still keep this budget neutral. The ACA has been, raises a ton of money taxing health insurers and pharmaceutical companies and investment income. So if those taxes go away, that makes it tough to balance.